today at the London Pain Clinic with one of the doctors, Dr. Jenna, to talk about fibromyalgia. So, Dr. Jenna, can you tell me about fibromyalgia?
The main problems that fibromyalgia sufferers are going to have are going to be pain, all over body pain, cognitive disturbance, so that's brain fog, short-term memory issues, that sort of thing. They get fatigue or tiredness is a big problem, and the other thing that they can get is they can get a multiplicity of other symptoms. So we have a checklist that we go through which has about 40 symptoms, and it's all sorts of things: neurological symptoms, headaches, constipation, hearing difficulties, skin irritation, you name it, the list is endless.
And what are the investigations?
So one of the things I tend to do when I see patients is I look for all of these sorts of issues. In some cases you can't find anything, but very often you will find the patients that I did have this flu-like illness, or I was going through a very difficult breakup, or I had a bereavement in the family, or it was a time when I was working 60, 70 hours a week, or I've had foreign travel, that sort of thing. So often we'll look for these underlying causes. Now, in terms of investigations, I tend to do a battery of blood tests. I will give a list of the blood tests that we like to do, and that's really looking at the blood, full blood count, looking at the function of the kidneys, urea and electrolytes. We look at the liver function tests. We look at things like vitamin D. We also exclude that they have any what we call inflammatory conditions. So this is another potential cause of fibromyalgia. And other blood tests we do is CRP, ESR, which is to look for inflammation in the body. If patients with fibromyalgia have very, very specific areas of pain, and the two main ones that we come across are people with very severe neck pain. So we may do an MRI scan of the neck to make sure that they don't have an underlying problem there. And the other one is patients who have very severe lower back pain, but it tends to be neck. Of interest to people watching is that there is now a test. It's called the FMA test. It's not available in the UK at the moment, but it's a US-based test.
So how do you assess fibromyalgia?
So when patients come in, the most important thing is to do a history. All of our patients at the London Pain Clinic, we send pain questionnaires before we see them in the first place. And what I will tend to do is use a scoring system, which is more of a paper-based exercise. The one I tend to use is the ACR, which is the American College of Rheumatology, and that's an extremely useful tool, really. Because again, it looks at pain, so there are 19 areas of the body that it looks at, and you go through each one of these areas, and it's a case of, have you had pain in these areas, yes or no, and you go through the checklist of the 19 areas of the body, and then we'll look at fatigue, cognitive disturbance, sleep disturbance, and in simple terms it's, have you had, for example, fatigue in the last week, and it's what level. So 0 is no fatigue, 3 is severe, and the patients will give you a whole number, so 0, 1, 2 or 3. And then there's another section in the ACR, the American College of Rheumatology, which looks at other symptoms, and there are approximately 40 symptoms that we look for, which are not main symptoms, but often patients have. So they may be headaches, constipation, bowel disturbance, abdominal pain, disturbance of concentration, memory issues, hearing issues, skin problems, bladder spasms, that sort of thing. And the useful thing about the ACR, the American College of Rheumatology, is that you can go through all of the checklists of all of these things quite carefully, and at the end of it you can actually do a score. You can score that particular patient on that day, and there are different sections, and essentially you will decide whether or not fibromyalgia syndrome is a good fit overall for that patient's symptoms.
And what are the treatments then for fibromyalgia?
So the mainstay of treatment, certainly in our clinic, tends to be medication based. So what we're trying to do with that is we tend to use a lot of anti-nerve pain medications. Now the more modern ones are things like pregabalin, gabapentin, duloxetine. Certainly duloxetine has a specific license to treat fibromyalgia, as does pregabalin. But there are also a number of other drugs, medications, which are used for fibromyalgia. Generally speaking, it should be possible to find a regime for an individual patient where they do get that maximum pain relief, that minimal adverse effects, and they do reasonably well. Other treatments that we use in fibromyalgia syndrome, one that people are aware of are things like trigger point injections. So my view on that is yes, we do them. We can inject trigger points with local anaesthetic, with steroid, we can use Botox, or we can use a combination of those. The ways of doing trigger point injections, they can be done like anatomically. You can work out where the actual site of the pain is, or you can use image guidance, usually with ultrasound, and you can see the muscle. Or sometimes if it is directly in the muscle, you can use nerve stimulation to locate it, or you can use a combination of those modalities to do the trigger point injections. A lot said about diet, and certainly out there are multiple different sorts of diets that people use in fibromyalgia. We do have some patients who have specific intolerances to foods, which may or may not be linked to their symptoms. And if we do have patients who their dietary issues are complex, or they may impact on their condition, then we will refer them to one of our dietitians that we work with. We have dietitians that look after our patients with fibromyalgia as well. As I said, if diet is a specific issue. Other treatments we use from a physical therapy point of view, we work with specialist pain physiotherapists, and the importance there with patients with fibromyalgia is, again, number one, we want to get their pain under reasonable control, so we use whatever techniques there, medications, etc. But another one is that a lot of these patients are very deconditioned. As we said before, they're very fatigued, they can do very little before they get exceptionally tired, and the pain physiotherapists will give them exercise programs. It's not a scary thing at all. It's not a, running marathons and that sort of thing. We're looking at gentle graded exercise program. We're looking at trying to introduce the idea of very basic exercise into the patient's life, essentially. And again, it comes back to we're not talking about going to the gym for an hour and going for it. We're not talking about multiple visits to the gym, getting a hardcore personal trainer, that sort of thing. We're talking about small, slow, steady, incremental increases in exercise. Certainly talking with patients and talking with our pain physiotherapists. At the London Pain Clinic, we do a lot of returns to work with patients who have fibromyalgia syndrome, and we are extremely honest with them from the outset, which is essentially from the time that we get your pain under some sort of control, you're looking at a minimum of 6 to 12 months. Realistically, 12 months to sort people out. The other thing that we look at with our patients is sleep. Now, I've mentioned before that fibromyalgia by some researchers is looked at primarily as a type of sleep disorder, and almost all fibromyalgia patients will have disturbed sleep of some type. Now, what we do tend to do is suggest that the fibro patients use some of the really simple things And the really simple things are things that they have control over. So for sleep disturbance, it's boring things that everybody knows but nobody does. So it's things like having a routine for your bedtime, warm hot milky drinks, having a set time for your bedtime, calming yourself down. Now, how do you calm yourself down? Well, staying on the internet, staying on YouTube, watching TV, what we call screen time, being on your phone until 9, 10, 11, 12 o'clock at night. People can't sleep, their brain's rushing around. It may be the blue light, there's blue light filters, but probably it's just that they're exciting their brain and then they can't calm down. What helps? Reading a book, having a nice bath, those types of things. It sounds silly, it sounds obvious, but the number of patients that don't do it is huge. Other simple things that we get patients to do for their sleep is blackout curtains. That can be very effective. White noise. Some of our patients find that very, very helpful. If you're on Spotify, if you dial in white noise, you can have aeroplane noises, you can get animal noises, whale noises, sea noises, anything you can think of, and that's quite helpful for sleep if you have that on overnight. A lot of patients will also use eye masks to try and cut out extraneous light along with the blackout curtains and that sort of thing. So for sleep disturbance, we have all of those ways of doing it. The other major issues that some people have is caffeine. So we suggest people stop after about 5, 6 o'clock in the evening, because obviously that's a stimulant and that can keep you awake. The other one's alcohol. A lot of people think, oh, well, if I drink alcohol, it'll help me to sleep. It may help you get to sleep, but the quality of the sleep is poor. Sometimes we have to use sleeping tablets with patients to try and get them to sleep. We only ever use those as short term because, again, although you may get to sleep, it is thought that the quality of the sleep is quite poor. You don't get the REM sleep, the dreaming, and the restorative aspects of the sleep are not very good.
Thank you for watching, and thank you to everyone at the London Pain Clinic. If you would like any further information about what you've seen, or you'd like to make an appointment, please visit the website www.londonpainclinic.com.